Thank you and good morning, everyone. My name is Wafaa El-Sadr, and I'm a professor of public health and medicine at Columbia University. And my message is invest in public health. Now, while the COVID-19 pandemic has thrown our city into turmoil, causing fear, suffering, economic and social disruption, and most tragically, the loss of many lives, it has also opened our eyes to three glaring realities. Number one, the fragility of our public health infrastructure. Two, the failure of the health system to meet the needs of the most vulnerable amongst us. And three, the crisis in trust that has hindered our ability to rally around the science and to come together as a community. These challenges compel us to rethink how to safeguard the health and well-being of all the people of our city. We must transform our approach to focus on advancing public health, literacy, and infrastructure to prioritize keeping people healthy rather than solely taking care of the sick. What will it take to achieve this? Two ideas. Number one, rebalance health investment to emphasize public health. The economics are clear. For every dollar spent on prevention saves almost $6 in health spending. And the return on investment is even greater if we focus on the most vulnerable populations who suffer the greatest with health disparities. The leadership of the city and the state should lead the charge by investing public dollars to establish community health hubs, to strengthen the rich array of community health-based organizations that distinguish our city, to support diverse cadres of community health workers, to modernize our public health infrastructure, and to solidify the links between public health and healthcare delivery sectors. Two, the leaders must also seek a collective public health literacy that can unite us all as one community. This requires local and state agencies to partner with community members and public health and communication experts to establish public health hubs, particularly in communities hurt most by the lack of health access and distinguished by poor health outcomes, where tailored public health messages can be developed and distributed through these communities. Most importantly, we must identify the trusted voices from various segments of our society and maintain them as consistent messengers for the future. While this pandemic has taken a terrible toll, it sent us an unambiguous message, a message about the power and potential of public health to build resilience and strength for our communities. It's a message that can guide us to a healthier, safer, and more prosperous future for our city. Thank you.